With school just weeks away, many are debating how the new year should look, and college is no exception. In today's two-year well-being, we are looking at everything that parents and students need to know before going back to college during a pandemic. Cone Health's infectious disease specialist, Dr. Cynthia Snyder, and clinical director of LeBauer Behavioral Medicine, psychologist Dr. David Gutterman are here with us this weekend. This Monday. What day is it? We don't even know, but we are so happy that you guys are with us once again to answer questions for us. So Dr. Snyder, we're going to start with you. So some college students, they may not think they need to worry about COVID-19. They're not in that high risk group for complications. What would you say about the virus to a young person who is going to college?
So, like many people in the community, I think it's super important to still wear a mask and also still try to maintain like social distancing, and then also doing hand hygiene, and then watching for symptoms and knowing if you are having some symptoms that are consistent with COVID. It's good to call your student health clinic, and also in quarantine. The majority of cases in North Carolina are in age groups that also include college students. So even though, a college student may not get sick enough to be hospitalized, they still can get pretty sick. That takes them out of class and potentially affects their roommates or their classmates and their families. So it's incredibly important to still follow those 3 W's.
Right. I know you touched on this briefly, Dr. Snyder, but what do college students need to do to reduce exposure while they're on a college campus with a bunch of other students?
So I know a lot of the college organizers and around Guilford County are working, as well as in Alamance County. They're working incredibly hard to create that social distance. So for a student, if you have an option to be in a single dorm, I think that's perfect. Still, when you're congregating or going out to classes, always wearing a face mask is the new ritual, I would say, and hand hygiene.
Mm-hmm.
Going to get your meals at the cafeteria is going to look much different. Try to eat outdoors. Some of the classes you choose may be staggered. Some of them will be in smaller sections, probably run by TAs. And then also for those bigger classes, it makes sense to do online schooling, like sessions instead.
Right. Dr. Gutterman, we turn to you now. Some people, they might be anxious about going away, being away from home during college, and then you add in the pandemic. So what advice do you have for students who are going back about how to handle that?
Well, there are different kinds of worries depending upon what the students' experiences have been for these last number of months of COVID. So, for example, there are some students who will be worried about transmission of the virus. And again, that can depend upon if they've had lost loved ones, or if they've been sick themselves, or have immune compromised family members. So they have very specific types of concerns about how they're going to protect themselves. They sometimes have worries and concerns about early return home, if they're going to come home on weekends, or if they're going to be sent home after a month being at school or something like that. And for these students, it's important to recognize their concerns are certainly normal. There are other like-minded students, and they need to remind themselves why they're taking care of themselves. As Dr. Snyder said, it's important to continue to take precautions. And some of the difficulties they might encounter is that not all students are going to have those same concerns, and so they might be ostracized and have some worries about being singled out or being seen as being different if they're not willing to participate in some activities that they don't consider to be safe. So it's important to plan ahead, plan how you're going to enter back into school, finding other students who take similar precautions as you do. Other students are less concerned about the virus and more focused on their anxiety about the loss of normality, not the loss of what they typically experience going into whether they're a freshman or they're an upperclassman. And they're really focused on their angst about things just not being the same as they were. And those students need to be thinking about, again, making plans on how they can be safe, but at the same time maintain maintain some degree of normalcy, socializing with their friends. Campuses are designed and built as being communities, close-knit, tight communities. And so it's going to be a challenge. It's going to be a very difficult challenge for students to have some semblance of normalcy during this time.
Right. I imagine it will also be a challenge for parents already. They're worried about their kids going off to school and the different risks that come with that. But then you add in a global pandemic and the risk of spread on a university campus. So what advice do you have for them?
For the parents, I think it's important twofold. First of all, listen to, before you impart your anxiety and concerns to your children or young adults, hear from them. You know, what are their concerns or are their anxieties, and have an understanding of where they're coming from first and foremost. It's important not to impose. You want to impart your, if you have concerns or you want to be able to talk to them about it, that's important to do, but don't impose your anxiety on them. You want to give them some sense of confidence, that you have faith that they'll make good decisions. But talk about what does it mean to make good decisions. Help them plan this out a little bit. There are things you can anticipate that they may not be able to anticipate that they'll be facing. So work with them, keep the open dialogue going, making sure that there can be good communication back and forth. That will help ease the parents' angst if they know that in fact their young adults, as they launch off, will call them with concerns, will help them. You help them plan for how they're going to integrate into school. Let me also say it's important that both parents and the students know that almost all schools have counseling centers, and to make sure you're aware of how to access those counseling centers because they do have staff who will be there and available to talk with students and parents if they're having any difficulties at all.
Right. And Dr. Snyder, if students do start to feel like they may have been exposed to this virus, what are the steps that they need to take?
So I kind of mentioning what Dr. Gutterman was mentioning is that it's good to know like what your student health center's clinic is, and also knowing that if you're starting to have symptoms, it is best to, stay in your ensure to stay in your dorm room and contact them to make an appointment so that they can anticipate you coming in for your evaluation of your symptoms. And I know a lot of the universities have protocols in place to ensure that the student will get evaluated and get tested. And then a lot of the universities are also creating spaces where if a student needs to be quarantined from the rest of their hallmates or their suite mates, that they get placed in a different room so that it can ensure that they are not potentially exposing further students from COVID-19. And also the universities are really working hard on anticipating how to do contact tracing and ensuring that they can test and also identify other people that may have been exposed to students. I think this is going to be a very challenging time, and we have some very sound public health knowledge and scientific studies that are telling us the importance of these very simple public health measures of wearing a mask, social distancing as much as you can. And I think the challenge is, there are many things in college that brings people in this tight-knit area, especially like eating meals together. And then unfortunately, there's been so many outbreaks associated with breaking bread with each other. And so knowing like how can you, I think dormitories and cafeterias are trying to create spaces where people can still have that community of having a meal together and discussion, but it's just going to be like further spaced apart.